Well, the discussions this morning are quite interesting. If you get yourself a copy of the Daily Monitor, you'll be looking to page 6, which has doctors' strike affecting service delivery, says officials. This brings us into our Tech Note this morning, where we get to look at this particular conversation. And I'm delighted to be having a chief resident here that's going to be enlightening us on the discussion, the matters at hand, who is affected and how the entire country is at stake if this continues on and on. But of course, the backbone of it is that senior house officers, qualified doctors who are training to become specialists while serving in public hospitals, declared a nationwide strike over payment of arrears in their April 28th letter to the permanent secretary to the Ministry of Health. Now, a total number of 693 doctors combined a voice in this letter, highlighting the miss out of payment for their allowances to the tune of 4 to 6 months. Why unending strikes in this sector, and how can it be ironed out, is a question that remains unanswered continuously. But I'm joined by Dr. Robert Lubega, the Chief Resident, Senior House Officers, to tell us more to this ordeal. Good morning to you, Doctor, and you're most welcome.
Thank you, Regina.
Okay.
Good morning, viewers. My name is Dr. Robert Lubega. I am the Chief Resident of Makerere College of Health Sciences, the national leader of senior house officers in this country. Senior house officers senior medical doctors who are duly qualified with their first 2 degrees, that's a Bachelor of Medicine and Bachelor of Surgery, and are now undergoing specialist training to become specialists. The gynecologists you see, those women doctors, pediatricians, the children doctors, orthopedic surgeons, the course I'm doing right now, the specialists of bones, psychiatrists, those that treat people with mental illness, and name it.
Right.
Those are the senior house officers that we're talking about. Yes.
Okay. So I know that in this letter you're addressing 3 categories. You're addressing the medical interns. You do have medical officers special grade, and there's a 3rd category. Could you give us insight into these particular categories and what their plight is currently?
Yes. First and foremost, of course, we have seen our junior colleagues, the medical interns, on the streets. It is very painful to watch, especially how police has been brutalizing these innocent, peaceful, demonstrating citizens who have been home for more than 9 months. They have graduates, they are doctors, they are nurses, degree nurses, degree midwives, pharmacists, and dental surgeons, who have already finished their degree and now have to undergo supervisory training for 1 year to become specialists. It has to be noted that for one to become a medical doctor, to be able to work as an independent doctor, they're supposed to undergo this very crucial stage of internship. And therefore, the future of the profession lies in the hands of having a very good medical internship. But however, the Ministry of Health came out and gave a notice that they will not be deploying medical interns, citing the fact that the Ministry of Finance had come out and said that they do not have money to facilitate this crucial workforce. It is very sad because we have to recall that for the medical interns to be paid the gross of 2.5 million, it followed the Presidential Directive in August 2021, where he requested an increment of the pay, which was 940,000 to 2.5 million. But some people up there went against the directive and want to scrap this money in the next budget.
So is that to mean that there's actually money for it? Because, I mean, all sectors are getting the budget cuts into the next financial year. That's the reality of the matter, that no matter how much noise you're going to make out of this strike, the money may not be directly there to cater to your needs so that you can end this strike. So that leaves you in a quagmire state, Doctor.
Yes, thank you for that question. I was still giving a small background. It also has to be noted that medical interns and senior house officers provide 70% of the health workforce in these hospitals. And that is according to a survey done by the Ghana Medical Association, our umbrella mother body. What does that tell us? It tells us that the first doctor that you will see in regional referral, when you go at night and your mother, you need an emergency cesarean section, is going to be an intern doctor. You understand? When you come to Mulago casualty and you have a broken bone, the first doctor you will see will be a senior house officer or an intern. When you come with a bleed in the brain, the doctor who will work on you at night in theater at Mulago casualty will be a senior house officer doing, or a clinical fellow doing neurosurgery. You understand? So we are trying to say that we need to reprioritize, because these people are providing this very important health workforce. And actually it has to be noted that the Human Resources for Health Strategic Plan 2020-2030, the Ministry of Health, this is a document that belongs to the Ministry of Health, they point out the fact that there are 70% vacancies of specialists in regional referrals, district hospitals, and the national referral hospitals, and yet we are training and releasing 150 specialists every day. I mean every year, who are willing to work in these hospitals. But what is happening is that the senior officers are providing this vital cover-up for these specialists. So we are asking the Minister of Finance, Minister of Health, and government to really reprioritize, because these are the people who are touching, who are treating the poor Ugandan out there. Amidst challenges of lack of supplies, we've seen on Twitter health workers entering theater with gloves as shoes, leaking theaters. That's the kind of situation we're in. But for the love of our country, we have kept serving, okay, and hoping for the best. Before I leave the issue of the medical officer special grade, it is interesting that we do not want to invest in our health sector. I think, I do not know the figure very well of head, but I think we invest over 400 billion in treating government officials outside the country. Currently, the budget we're talking about that is required to pay senior officers and this medical cadre of interns, which is very crucial, is 80 billion. And we need, I think, about 21 billion to be able to enhance the salaries of the medical officer special grades. Who are the medical officer special grades? When we leave school as senior officers, we are going, the next level that we go to, the one next to the consultants, is medical officer special grade. First and foremost, we are requesting public service to work together, Health Service Commission, Ministry of Health, to first restructure this name, because it is somewhat deceiving, because this is a specialist, but we are calling them a medical officer special grade. And that is when, during the enhancement from senior medical officer to medical officer special grade, there's only an increment of about 200,000, and yet the consultant was at 13 million. So the person who does more work, the actual work, is earning 50% peanuts. You understand? So this is the cadre which was left out, and we're calling upon all those that are, all the Ministers of Finance, because this is 21 billion. So in total, we need 80 billion to sort out these, 100 billion to sort out these three very crucial cadres. Okay. Last week when we were in Parliament, in the Parliamentary Health Committee, ministers pointed out that there was an investor who was given 80 billion last year to invest in their business. So if we can give 80 billion to an individual, if we can find 400 billion and invest in the health of a few government officials, why not invest this 80 billion for this crucial workforce?
Okay, all right. Of course, we have been seeing some pushing trends here and there. We did have the pothole exhibition that pushed the president to give a directive of 6 billion on a quarterly basis to KCCA, and then came the health exhibition for Uganda. And I know that it's definitely been a voice to aid your plight in what's going on. What do you hope this strike is going to push for? Yes.
We actually, our irreducible demands as senior officers are mainly three. One, we're asking government to deploy all medical interns. We're actually in a crisis. I have to share a story, a very painful story. There's an auntie who shared a story of her nephew, who was the best in their class. He went on to do medicine. He graduated top of his class 9 months ago. And because he's been home, he's a doctor who is seated at home, who cannot work. He, when they decided to march, he was one of those people that marched. He was brutally beaten up by police. He bled. They tore his clinical coat. And the boy right now is so depressed. And he actually told his auntie and his mom that he wants to go to the Middle East. Even if he goes and does cleaning or whatever, he's tired of his country. So that's the kind of situation. Right now, our juniors in medical school are really demotivated by what we are trying to do, because we are trying to find easy solutions, hiding our heads in the sand. We know how crucial and critical this health workforce is. Most of us graduated on top of our class. In 2011, as a Bishop Cipriano, I got 24 to 25. And I thank government for catering for my tuition at Barra University of Science and Technology. You understand? But we have these brilliant minds who we are neglecting, who we are making to head the profession, because the seniors are going to leave. And actually, I have to point out, the medical officer special grades, we have several consultants leaving this country, going to South Africa, going to Kenya. When you go to Aga Khan Hospital,
going to Australia.
Yes, going to Australia. When you go to Aga Khan Hospital, you're going to find Dr. Poka.
Actually, there's an African country that put a ban on exporting of medical workers because they need them in the country more than they're needed outside there. They've invested money in them, so it makes sense.
I'm going to give you just three. There's Dr. Opoka. He's one of the best one of the best researchers we have in the country. Okay, he's a professor of pediatrics. He is currently the dean at Aga Khan. You understand? In Kenya, we have Dr. Opio, one of the few liver specialists we have in the country. He's shifted over to Aga Khan. We have Dr. Nekon. He's the head of anesthesia in Aga Khan. All these are Ugandans. When people are flown out, they're going to go out there and meet the specialists. Why? We're demotivating them. You cannot be giving the first cadre of consultants almost 50% less than the next cadre, and yet they actually do, and they do this actual work. So I think we should really look at finding long-standing solutions, and many of them have been proposed.
All right. So while all this is going on, you've laid down your tools. Who's handling, the emergencies and the cases, especially given the fact that you're specialists and professionals? Your expertise is definitely eminent in this whole ecosystem of the healthcare system.
Thank you very much. I was still stating our three reducible demands. One is to deploy these medical interns. Number two is to enhance the pay of these supervisors, because they are our direct supervisors, medical officer special grade, but in the same vein, change their name from medical officer special grade to associate consultant.
So which one is more important right now? The arrears, the increment in payment, or the name change?
So the most important change right now is, of course, the change. We feel the change is actually an easier thing, but of course it's the money commensurate to the skills that these people are providing. Yes, so we need an increment of the senior office, of the medical officer special grades from 6 million to 11 million, because the next cadre earns 13 million.
And how did you determine that increment?
Yeah, so it was based on the previous on the previous salaries. Before the enhancement happened, there was about a 1.6 million gap between the consultant and the medical officer special grade. But right now we have a 7 million gap between consultant and, so that was the basis as to why this the specialist associations decided that the gap between consultant and medical officer special grade should at least be 2 million, and that is 13 and 11. But the other important thing why we actually went on strike is because we have been, the senior officers, this very crucial cadre serving Ugandans, has not been paid for more than 6 months, for 6 months. Okay, when we launched our strike in Feb, which ran for 2 weeks, the Minister of Health, Minister of Finance, the Parliamentary Health Committee, we would like to thank Dr. Charles Sayume. He has been very vocal on issues with health, and the Parliamentary Health Committee for always standing out for us. They actually invited us for a meeting, and we actually present. UMA was there represented by the President, Dr. Naku. They presented these proposals as we have always done before, but they keep gathering dust. And Minister of Health somehow found some money and got and paid some of us about 50–60% money for 2 months. Actually, I think it's about 50% about money for 2 months. So we said that for the love of our country, and since they have showed this goodwill and they have promised to work on our issues, we are going to suspend our infrastructure. Now we suspended it on the 5th of March this year, but now 2 months later, that is 6 months without pay, 4 months without pay. We hear, one, that they're scrapping the money of senior officers and medical interns from the next budget, from the budget. People who are actually treating the Ugandans. It's
not resonating with what you sat down in the Parliamentary Committee and they shared with you. Okay, any other responses that have come out from government or even the Ministry of Health in particular, getting into day 2 of this strike?
Yes, so today we were invited for a meeting with the Permanent Secretary of the Ministry of Health, and a team will be going to represent in the afternoon. And we hope that we shall have positive engagement, because for us, we are pro. We would like to sit down with government and find.
When you say you hope for positive engagement, what is the positivity you're hoping to hear? The
positivity we are hoping to hear is, one, that all senior officers from year 1 onwards are going to be paid their arrears. Because I did share with you a story. There's a lady who approached me about 2 weeks ago. She had been locked out of her house. She was sleeping in the lecture rooms for 2 weeks. This is a lady doctor. You understand? She has to wake up from the classroom, find wherever she can find, brush her teeth, moving with all her clothes in a bag, and then head and treat Ugandans. Okay? And of course, she approached us as the leadership, and we talked to some few people, and they allowed her to be there. More than 10 people have dropped out of the courses. You understand? Yeah. This small money is a motivation. We have a human resource gap for specialists. This small 2.5 million, many of us are married. We have children. Our kids have been home. You understand? People are not able to pay rent. Because who of those officials in government can go more than 1 month without pay? We have gone up to 6 months, half a year without pay. I think it is only fair for them to sit down and find this money, okay? And also include us in the next financial year's budget, okay? And also start the discussion of enhancing medical officer special grade salaries. And those are the positive engagements that we hope to hear.
Dr. Lubega, is there a timeline to this strike, the current strike? And with that, if nothing is done from the necessary entities, bodies, and government, what next?
Yes, I think we have seen statements from one Uganda Medical Association, who is our mother body. We have seen a statement from the Association of Gynecologists of Uganda. We have seen a statement from the Association of Surgeons of Uganda, which I belong to. We would like to thank Dr. Musana, who is the president of the Association of Gynecologists of Uganda, Professor Frank Asimwe, who is the president of the Association of Surgeons of Uganda, and his committee. They wrote a very good document, which I have here. I will share with you. It has several of these recommendations. If time allows, I'll share out 1 or 2. And then we'd like to thank the Association of Physicians of Uganda, who have also come out to make a statement, and they're all speaking this same voice, okay? Also yesterday we saw a statement from the Ophthalmology Society of Uganda, those doctors who specialize in doing eye surgeries and stuff. So the voice is the same. And I can tell you that from the rumors I am hearing, that the medical officer special grade are organizing themselves, because they are the neglected children. They were the neglected children during this enhancement. They are not happy, and even the consultants and senior consultants, because an attack on the young trees is an attack on the entire forest.
When you had the engagement with the Ministry of Health, did they show you at least a plan to cater to all these grievances in the near future or even long term?
When we sat down with them, unfortunately, it appeared they had dropped the ball. And because they were saying, Minister of Finance tells us that there's no money. They appropriated 80.5 billion for the next financial year. Minister of Health says they have 10 billion. You understand? So it appears they have dropped the ball. So it's better we leave these medical interns, senior officers scrapped off of the budget. Okay, it's out of our hands.
And what's the repercussion of that scrap in case it becomes a reality in the next financial year to the health sector in Uganda?
Yes, this is what I am going to. This is one thing that we should know. That one, our seniors, some of whom are in the Ministry of Health, they were interns before. Okay, I think yesterday the former Mbara Municipality MP, Dr. Vitekerezo, wrote a very touching story. That had he not had this small allowance, he would not have catered for the burial arrangement of his dad. You understand? So all our seniors know, when you're an intern, you are on the ward 24/7. When you're a senior officer, most of them were senior officers before. Of course, they were unfortunate that they were not being paid, but we are targeting to reach the middle income. You understand? We cannot be comparing ourselves to 20 years ago. You understand? So, and actually most of them, because there were few doctors, most of them were employed by government, and they would come back on study leave. They still had a salary, which is not the case now. Okay? We have unvacant positions. Yes. So we need, we really need to work on these issues.
Okay. All right. For some of the addresses that you had mentioned, could you share with us 1 or 2 of them?
Yes. So one one of our recommendations is, of course, government out there. First and foremost, again, I would like to thank the President of this country, His Excellency Yoweri Kaguta Museveni, because it's following his directive, 9th August 2020 at our Grand Doctors Conference, that senior officers were paid. Okay? The senior officers, this money started coming. Okay? In 2021, following the doctor strike, still he wrote a directive to the office of the Prime Minister to have interns and senior officers paid. And this was actualized in a meeting by, chaired by the Honorable Dr. Chris Variomunsi, who, on behalf of government, wrote an agreement, okay, an agreement which copy we have, we shall share with you. And in that agreement, senior officers were to be paid 2.5 million, intern doctors 2.5 million, intern pharmacists 2 million, intern nurses 1.5 million. So all these things are commitment. I mean, all these are commitments from government. We're not asking for more for now. You understand? We're asking for them to implement the presidential directive. They should respect the presidential directive. And then our other recommendation is, of course, the Minister of Health is coming out complaining about the numbers, that the numbers are going up. It should be a good thing, because Uganda is a very fertile country. We are currently at about 46 million, with a doctor to patient ratio in the public sector at 1 to 20,000. You understand? WHO recommends 1 to 1,000. So we should actually be happy, okay, that we are having many health workers coming up. We are training more doctors. But of course, we have to be cognizant of the fact that of our resource envelope, like you said. So what should happen is, because of our restricted resource envelope, we have always suggested, like Minister of Health, work together with the Minister of Education. Minister of Health should, based on how their capacity to train, to tell the Minister of Education how many medical students should be admitted. And for that, we proposed regulation of entry into medical school. Okay. And things like that. All these are written.
Control the numbers from the grassroots, so that you can be able to fit within the present budget framework.
Exactly.
Okay, that's a very interesting analysis there. Of course, then that means that whoever has hope in getting to become a medical worker in this country will be challenged by that. You do have the entry bar for those that want to become lawyers. Should it be the same applicable for doctors in this country? It's a question that maybe you could share your thoughts with us on our social media platforms. But for now, this brings us to the end of our discussion. We hope that given the fact that this strike has come in between the preparation for the next financial year, some good news will come out of it, but we'll be following that story very closely. We take a short breather. We return shortly.